So hello everyone, I'm James Jordan, Dr. Jordan, Neurology, and this educational video, hopefully brief but to the point and useful for you, is what to do if you have a seizure in the epilepsy monitoring unit. We have instructional sheets that should be up on 8 North Nursing Station. You can always call neurologists or the EEG technologists to get these. We also have cards with everything I'm about to go over in the video that should again be up at the 8 North Nursing Station on what to do if you see a seizure. To begin with, if you're at the nursing station and the seizure alarm goes off, you're going to want to remember first and foremost to do 4 things. You're going to go in, well, first is ABCs, make sure everyone's safe. But you're going to want to make sure the seizure button is pushed if it was not already pushed by the patient or their family. You're going to want to remember to stay clear of the video that's on the corner of the room so that you're not blocking what we're looking at to be the seizure or non-epileptic event. You're going to want to remove blankets so that we can see on the video, and you'll want to make sure to turn lights on in the room. Having a seizure.
In the event of a seizure, into the room, stay out of the camera and turn the lights on and pull back the blankets. Note the time of onset and say this out loud and push the seizure button.
Start time.
Do your ABCs and BLS if needed.
So as you saw, you want to say everything out loud, including the time of onset. Then the first thing you want to do is test memory. So you're going to ask them to remember some simple noun and adjective like blue fox or red elephant. Then you will proceed with ANO times 4. You know, how are you feeling? Who are you? Where are you? These sorts of things. Note the interactivity, and again, try to say everything out loud. The camera doesn't pick up everything. If you see pupillary differences or anything like this, let folks know out loud. You want to test motor, so have them lift up their arms. You're also testing verbal commands, and we can then see some asymmetry if there's Todd's paralysis from a seizure or something like this. Again, all of this is on your handy-dandy card. As you heard, you'll say everything out loud. That will help us. We can't see certain things. And use your card, note the time of onset. Then, after you've taken care of the preceding ABCs, you'll want to test memory, and you'll test it again later. So ask them to name something a little unusual, noun and adjective, like a red fox or a blue elephant or something like this. And then you will see how they're doing. Basic ANO type of stuff, orientation. Who are you? Where are you? What are you doing here? Then you'll test naming, something just quick and basic. Can you tell me what this is called? You know, a pen, or point to a clock on the wall, something that's available and easy. And then you'll test command as well as motor. You want them to maybe lift up both of their arms. We'll be able to see maybe an asymmetry if there's a Todd's paralysis, or we'll be able to see that one arm is not able to do something because it's having a seizure.
Now you're going to do some clinical testing. Ask the patient the following. Remember blue elephant.
Remember blue elephant.
Ask them how are they feeling.
How are you feeling?
I don't know.
Ask them their name.
Can you tell me your name?
Where are you?
James, in a hospital. I heard it.
Perfect. What's your birth date?
June 24, 1970.
Can you tell me why you're here?
I think you're looking to see if I'm having seizures.
Ask them to name something, a pen or a clock.
Can you tell me what this is?
That's your badge.
Perfect.
Have them touch their nose with right or left hand or point to the ceiling.
Can you touch your nose with your left hand? Perfect. Can you point to the ceiling with your right hand?
Have them raise their arms.
Can you
or
raise
smile.
both arms up for me? Perfect.
Observe and note level of consciousness, pupillary size, any abnormal movements or behaviors, and describe these things out loud. Include any autonomic signs.
So you kind of get the idea. You're going to be testing a lot, and again, remember to say everything out loud. Now, I wasn't actually having a seizure, obviously, but if you're actually seeing a seizure, you'll actually want to detail every evolutionary step of the seizure as well. Right arm is now twitching, right leg is now twitching, the patient is turning their head to the right, something like this. You heard look out for autonomic signs. That's a little unusual, but you might see flushing or goosebumps unilaterally. Again, making sure ABCDs are taken care of. At some point, you'll see what seems to be the obvious clinical seizure stop, and you'll want to note that time as well. Try to. We can always pick it up on the EEG too, but try to say time of stopping seizure 1:20 or something. If you note that the seizure has not stopped and it's been about 2 minutes and you think it's a real clinical seizure, you should have rescue medications ordered. Now's the time to go get the Ativan to stop the seizure and call the attending who's on right now. So now I'm going to actually have what looks like a seizure.
Observe and note level of consciousness, pupillary size, and any abnormal movements, behaviors, and describe these things out loud. Include any autonomic signs. Note the time when it seems the clinical seizure has stopped and the duration.
Right arm shaking, right leg shaking, head turning to the right. Patient relaxes. Seizure end at 1:30, approximately 2 minutes.
So again, if the seizure goes more than 2 minutes or so, or whatever the order is in the computer, give the rescue Ativan and notify the attending. And then it's time for the post-seizure assessment once your seizure is over. Again, always staying away from the camera, again, always saying everything out loud. First thing you're going to want to do is probably turn off the seizure alarm. It's probably driving you crazy. You do that behind the bed. There should be a silver and a white plate that you would push to turn it off. And then the post-seizure assessment is sort of the same stuff you did during the actual seizure assessment. I start with a memory, see if they remembered the strange adjective and noun that you gave them, whatever it was, blue elephant. And then see if they're oriented now. Note the time. It might take them, if they're post-ictal, 5 minutes to get there, so you might have to keep reassessing to see when they actually come back online. It's test motor again. Probably good to do legs as well to see if there's any focal weakness anywhere. If family's there, or if the patient didn't lose consciousness for the seizure, it might be a good idea to verify that this was one of their typical seizures or events. Some people have multiple seizures. We want to try to make sure we capture all of their events that we're trying to figure out if they're even seizures or not. Now this I'm going to cheat and read from the sheet that you should have up on the nursing station, because this is nursing documentation in EPIC, and it's something called Adult PCS Body System folder Neuro, folder Additional Documentation, folder Seizure Episode. According to the nursing supervisor that gave me this, you'll know what that means, but ask us if you don't. And when you actually chart the seizure, you'll want to record everything that you actually verbally did, the best you can remember. So the time of onset, the time of offset, sort of what the evolution was. The seizure presentation, any focal findings or unusual clinical findings, how long post-ictally before they came back to themselves or their baseline, whether or not you needed to give any seizure rescue medications. Again, notify whoever's attending in the day or night if you had to do that. I think that pretty much sums it up. Again, you'll have a cheat sheet card. Hopefully it's convenient enough where you can just keep it in your pocket. You should have the more detailed sheet. It's everything up at 8 North by the Epilepsy Monitoring Unit. Obviously call the neurologists or the EE technologists if you have any questions or concerns. And thanks for all your work and trying to help these folks with seizures.